Greetings and welcome. I'm Heidi Mastrew, Director of Alumni Relations for the University of Minnesota School of Public Health. Thanks to all who are joining us live today, as well as to those of you who catch the recording afterwards. In a moment, I'll introduce Dr. Sonya Brady, today's presenter. But before we begin, I'd like to share a few updates and housekeeping notes. Our school's experts bring clarity and scientific knowledge to a range of topics critical to understanding and managing the COVID-19 pandemic. We invite you to take a deeper dive into our collection of COVID-19 related science and research stories online. Health in All Matters is a weekly podcast produced by our school to bring more understanding of public health challenges across the globe and close to home. We include expert voices from our faculty and their colleagues around the world. Our premier series focuses on COVID-19 and the many issues it brings into question, such as transmission and prevention, life in a pandemic, loneliness and mental health, and the medical supply chain. You can find the podcast on our website or subscribe on Apple Podcasts. On April 26th, Twin Cities Public Television premiered Our Invisible Guardians, a 30-minute documentary about public health and the many people who work behind the scenes on issues vital to keeping us healthy. Since the film was made a short 5 months ago, COVID-19 has changed our world dramatically, and public health is now far from invisible. You can still catch the documentary online and follow the conversation on social using Invisible Guardians as the hashtag. And we're putting together more virtual opportunities related to COVID-19. Our upcoming community health-focused webinar is listed here, and you can find past event recordings on our COVID-19 website. For those of you joining us in real time, questions are welcome and you can submit them at any time. Our audience Q&A will be at the end of our hour together. Please type in your questions by clicking on Q&A, not the chat button, on your screen. We'll get to as many questions as time allows, and we may go a bit over the half hour that we've allotted to make room for more questions. If that happens and you have to leave, you can catch the recording online afterwards and you can listen to more questions from the audience. Now on to the topic at hand. We find ourselves at an interesting moment in time, to be sure. The importance of public health has never been so visible in my lifetime. Today's webinar is one of a series we've pulled together on community health during COVID-19. We are attempting to address how we might understand and promote community health during a time when our normal routines have been upended due to the current pandemic. Luckily, we have the vast expertise of our faculty from the Division of Epidemiology and Community Health within the School of Public Health to help us make sense of it all. Today, I am thrilled to be joined by Dr. Sonya Brady, Associate Professor in the Division of Epidemiology and Community Health. Dr. Brady's research examines how normative developmental experiences and stressful life experiences can influence risk behaviors among youth, and how assets of individuals and their families, peers, schools, and communities can promote health protective behaviors. This includes research on mental health and emotional well-being, sexual health, violence exposure, substance abuse, and health equity. Her research utilizes technology to measure and promote health protective behaviors among youth. It also utilizes community partnerships and coalitions to reach diverse communities. Dr. Brady, I'm so happy you're able to join us today. Please take it away.
Thank you, Heidi. And thank you everyone for joining this morning. I'm happy to be talking together. Okay. So in public health, we situate the individual within a larger social ecology. When we think of COVID-19, there is no aspect of our social ecology that has not been impacted by the pandemic. It's impacted the way that we interact in our close interpersonal relationships with our family members, with our friends, with our colleagues. It's impacted the way we work, the way we go to school, the way we worship, the way we interact in our communities, and if we can even interact in communities. It's impacted our larger society and public policy. COVID-19 is certainly a stressor that we're all experiencing to different degrees. When we think of an individual embedded within social ecology, stressors can be generated at any level of that social ecology, and stressors can also be generated from within. So today, I'm going to talk broadly about stressors and focus periodically on COVID-19, and I'll also focus on how we can cope. Coping is what we do to manage the stress that we perceive. So we focus on larger social ecology within public health, but I'll be focusing especially on the individual level today and our perception of our environment. So before we go on, I'll define some key terms. What do we mean by coping, stress, and well-being? Coping is defined as cognitive and behavioral efforts that individuals make to manage internal and external demands that they appraise to be challenges or threats to resources and well-being. Stress is perceiving that a situation taxes or exceeds one's psychological, social, or material resources for coping. So throughout this presentation, you'll hear me sometimes use the word stressor and at other times use the word stress. A stressor is anything that has the potential to be perceived as stressful by us. But individuals really vary in the degree to which they perceive something to be stressful. We can see this with COVID-19 when we observe our own responses and others' responses, and how stressful something is can vary over time as well. It can go back and forth. Well-being is the perception that one's life is going well. It's a multi-dimensional index of how people think and feel about their lives. So here I have a link to the Centers for Disease Control. They have a nice page on well-being where they start by talking about how there's no real agreement about how we should measure this construct, but it's an important construct. And we'll make sure that these slides are available to you after today's presentation. Well-being is not merely the absence of stressors. In fact, we all experience stressors. We all experience stress. That's a normal part of our lives. Well-being is not the complete absence of negative feelings. Negative feelings are important indicators that something's not right and we should do something about it. So well-being doesn't mean that we never have a negative feeling. Psychological well-being includes different concepts that are important and are often left out of different measures that we have when we're looking at mental health, for example. It includes self-determination, or the perception that we have autonomy over our lives. It includes self-acceptance, having a positive evaluation of ourself and our past life, even if we want to go in different directions in the future. It includes having a sense of purpose in life, having opportunities for personal growth and taking advantage of those opportunities. It includes positive relationships with other people and having the capacity for coping. So psychological well-being is just one type of well-being. Two other key components of well-being are life satisfaction and positive emotions. Life satisfaction is more dependent on whether basic needs are being met, such as food, shelter, and income, whereas positive emotions are more dependent on having supportive relationships. And all of these concepts are very important in the time of COVID-19. So how can we cope with stress to promote the well-being of ourselves and others? If there are one or two slides that I'm hoping you'll remember from this presentation, this is one of them. When we experience stress, everything can seem jumbled together, and it's hard to know where to start in terms of how to cope. The cognitive behavior therapy model separates the experience of stress into 4 key constructs. There's the situation that's causing us to feel stress, and again, that can be internally generated or externally generated. There are our thoughts about the situation, and our thoughts in turn can impact the way we feel. Our feelings can impact our behaviors, and our behaviors can in turn impact the situation. So I find the cognitive behavior therapy model important. It's not just for therapy, it's for day-to-day life. It's important because it helps to point out what we have direct control over and what we only have indirect control over. So if we think of COVID-19, the situation, we can't wave a magic wand and take away COVID-19, but we can try and behave in ways that positively impact the situation. We can try and flatten the curve. We can wear face masks when we go out and we're grocery shopping and we're interacting with people who are essential workers to try and protect them. So we can try and positively impact the situation by protecting others and ourselves. So we have direct control over our behavior, but not direct control over the situation. Now, feelings are another thing that we can't really control. They just well up inside of us. And if other people tell us to change our feelings, it often can feel invalidating. If someone says, "Don't worry, be happy," or "calm down," that's not how we're feeling in the moment. So we don't really have direct control over the feelings, but what we do have direct control over is the way we're thinking about a situation. We can catch those thoughts that are making us feel badly and try and challenge or reframe those thoughts. So we'll talk more about this. But the 2 key ideas here are that we can behave in ways to try and positively impact the situation, and we can try and think in ways that help us to feel better. And we can use this to approach stressors big and small. So I wanted to give an example. Rhonda Jones-Webb, who is a professor in the Division of Epidemiology and Community Health, and we have a partnership with the Office of Violence Prevention, which is part of the Minneapolis Health Department. And on Friday, I was meeting with 2 of our community partners. They are navigators for the police department, community navigators, and they try and help the police interact with communities where there is a history of not getting along well with the police, of mistrusting the police, of practices by the police that were unjust to the community. So it can be hard for police officers to go into that situation. And I was meeting with our navigators, and they were just talking about their work. And what I realized is that they were really following this model without even realizing it. And that's often the case, that we follow this model without even really thinking about the components. So one of the community navigators was in the military. So he's a former soldier, and he talked about situations where he had to go into communities or into households where family members might be suspicious of him, might be wary, not have a good history with our military. So he said, I try and walk in with a whisper. And this is what I tell police officers. You don't have to go in being loud and commanding and taking charge. You can go in quietly and listen. And the other community navigator said, I tell police officers to try and look for a spokesperson, someone who is calm and rational, appears to be trusted by different people that you're interacting with. Try and talk with that person and see if they can ask questions of other people and help you gather the information you need. So while we were talking, I pulled up this model and I said, sounds like you're really behaving in ways that positively impact the situation. They said, yes, we're trying to de-escalate something that's tense, and we know that the way we behave matters. And then one of the navigators said, people don't call the police when it's a good day. If it's a birthday party and they want you to have a slice of cake, they call you if something's gone seriously wrong. And so you can walk in and people are upset, and some people might be upset that the police were even called. They might yell at you, they might call you names. Getting frustrated, getting upset, annoyed, that's not going to help the situation. The navigator said, we need to regulate our emotions so we can do our job well. And I try and tell myself, this might be the worst day of their lives. And that generates compassion on my part. It generates patience. It helps me do my job better. And I said, wow, you're thinking in ways that help you to feel better and regulate your emotions so you can do your job. This is such a great example of this model. So our community partners in their day-to-day practice, they're thinking intentionally about how they can behave in ways to positively impact the situation and think in a way that helps them to feel better, to regulate emotions, to do their job. So again, the things that we can control, the way we behave, and the way we think when we approach different situations. So in the example that I shared with you, the community navigators were helping police officers to engage in both problem-focused coping and emotion-focused coping in a potentially tense situation when they were responding to a call. The distinction between problem-focused coping and emotion-focused coping is an important one. So I tried here to show you different ways of coping and how we can really think of these as different forms of problem-focused and emotion-focused coping. Problem-focused coping is a strategy to manage problems and try and change a stressful situation. So trying to de-escalate a potentially tense situation, you're trying to directly impact that stressor. So different ways of coping that fit under this category are seeking information, problem solving, so engaging in thoughts that are aimed at finding solutions, and acting in a way to bring about positive change. Emotion-focused coping, in contrast, doesn't try and change the stressor. It tries to change the way that we think or feel about a stressful situation. So seeking emotional support from others, religiosity, positive reappraisal. These are thoughts that are aimed at feeling better. Tomorrow is a new day. This is difficult, but I'm going to be stronger because I'm going through this. Trying to see the good in what is happening. These are all different ways of positively reappraising the situation and focusing on how we can think in a way that helps us to feel better. Now, some people separate out distraction, avoidance, and denial from emotion-focused coping. I've grouped them here because these really are attempts on our part to feel better. And the way we're trying to feel better in this case is to completely remove ourselves from the stressor. So we'll talk more about these strategies. So one reason that the distinction between problem-focused coping and emotion-focused coping is so important is because problem-focused strategies tend to be best for controllable stressors, and emotion-focused strategies tend to be best for uncontrollable stressors. You know, imagine if something is completely out of our control and we keep trying to solve the problem. We're going to hit a brick wall. It's going to make us feel terrible because we aren't able to fix the problem, and that's because it's not controllable. And also imagine if we only engaged in emotion-focused strategies for coping when something is controllable. Then the problem persists, or it may get worse because we're not really getting at the root of the problem. So one important caveat here is that even if something is controllable or partially controllable, we might need to engage in emotion-focused coping before we're ready to engage in problem-focused coping. And this is true of the communities that we interact with as well. We might need to feel better, to relax, recharge, feel supported, feel validated before we're ready to tackle a problem with problem solving. Okay, so what does the literature say? Well, strategies that are generally helpful are problem-focused coping, especially when stressors are controllable, emotion-focused coping, especially when stressors are uncontrollable, and seeking support from others. Now, seeking support has numerous benefits, including that others can help us solve problems. They can give us ideas, advice. They can model how to go about solving a problem. And others can also give us emotional support, help us feel better, tell us that we're accepted, we're loved, we're cared for, we're not alone. Generally, unhelpful strategies include denial, distraction, disengagement, avoidance, helplessness, wishful thinking, coping through anger, such as hitting a wall or smashing something with your fist. Generally unhelpful strategies. But especially in this time of COVID-19, I did want to highlight healthy versus unhealthy forms of distraction and disengagement. Sometimes we do need to get away. So a temporary break from thinking about stressors, such as by engaging in hobbies and entertainment, that can be okay. And I'm not surprised by the fact that so many people want the gardening supplies to be open, the stores that sell these supplies. So many people want to be able to buy a can of paint and work on their house, work on their garden, go outside, be outdoors. So I've been paying attention to Minnesota and how, for the most part, we can still have access to these things, and I think that's helpful. So many of us, each evening before we go to bed, are spending a little time with Netflix or Amazon Prime and watching a show. We're trying to remove ourselves from the stressor and feel better, to relax and recharge, and that's okay. In fact, I would say that's necessary for all of us to find those temporary breaks. In contrast, forms of distraction and disengagement that can be harmful are activities that may become unhealthy habits. And here I have the example of using alcohol or other substances to cope. And I place the emphasis on to cope. In public health and other disciplines, we have different measures for substance use and for substance use to cope. And across the literature, using substances as a means of coping with stressors, it's just uniformly associated with poor outcomes. So it's something we want to be mindful of. Why am I having this glass of wine? Is it because I'm trying to escape from something stressful? It's a good idea to find another way to cope with that stressor. So as I was putting together these slides, I came across this article written in March. So the headline said, "America is drinking its way through the coronavirus crisis, and that means more health woes ahead." This is a figure taken from the article written by David Jernigan from Boston University. The figure shows the percent increase in alcohol sales from 2019 to 2020 for the week ending in March 14th. So we can see that off-premises sales of alcohol in the United States were up for the week ending March 14th compared to the same period last year. Wine up almost 28% in sales. Spirits up over 26%. Beer, cider, malt beverages, 14%. 3-liter boxed wine, over 50%. 24 packs of beer, 24%. Online, 42%. Now, the scientists among us may say, we don't know if all of this increase is due to coping with COVID-19 through alcohol use. People aren't able to go to bars and restaurants in the same way that they were used to. They might be afraid that alcohol sales will be deemed non-essential, and so they're wanting to stock up. But people were stocking up in the same way they were stocking up on toilet paper. So it's reasonable to think that some of this might be coping. So I wanted to have at least one example where we applied the cognitive behavior therapy model to a stressor that many people are experiencing due to COVID-19. And like many of you, I've been listening to public radio, I've been watching cable news, just listening to how other people are feeling. And one big stressor that a lot of people are feeling is financial insecurity. So I wanted to show how we can use this model to be intentional about our approach to coping with financial insecurity due to a layoff or a potential layoff. It's important for me to acknowledge that it takes a lot of time and effort to apply the strategies that we're talking about. So we're just going to take a few minutes here, but in reality, it takes a lot of time, a lot of effort. This model is meant to help us manage stressors that can seem overwhelming or are overwhelming. So I've broken this down into a series of 3 steps. First, we need to recognize the impact of a stressor on our thoughts, feelings, and behaviors. So these are just examples of what someone might be thinking in this situation. I might lose my home. I might lose my apartment. No one can help me. And naturally, repeatedly thinking this would lead to feeling high levels of anxiety and helplessness. And how do we handle those feelings? We just talked about a lot of different ways that people can behave. So the second step is to think of what we can do to positively impact the situation. So the University of Minnesota Extension was very helpful to me in terms of putting together this slide and thinking through possible responses. And I've linked here to the resources that I use. There's much more if you click on these links. And again, we'll make sure these slides are available to you. Possible responses include completing a spending worksheet to gain a better idea of expenses. And the extension has a very thorough worksheet to do this exercise. Setting spending priorities, deciding which bills to pay first, talking with creditors. A creditor would much rather have us call and talk to them than not communicate at all. It might be possible to come up with a new spending plan or paying our finances. Talking with family and friends who might be in a position to help. This is something that comes more naturally to some people than others, but it really is an important way of behaving to try and positively impact the situation. Looking into government assistance programs and protections against eviction. So in Minnesota, Governor Walz signed an order, no one should be evicted from their home during this time. So there are protections. And again, I've linked to resources for this. And the third step is to try and challenge or reframe thoughts that lead to negative feelings. So it's hard to even make a list like the one I just showed you, or to work little by little on that list, unless we feel like we're in a mindset and our feelings are such that it enables us to do that type of problem solving. So how can we challenge or reframe the example thoughts that I gave you? I might lose my home or apartment. No one can help me. Well, if we're creating that list and slowly working on that list I showed before, we can say to ourselves, I'm doing everything I can to prevent losing my home or apartment. If I do need to move at some point, I can move in with this family member or friend, or seek assistance from this government program that I did research on. The idea or thought, no one can help me. Now here I sometimes like to think of an onion and layers of an onion. Sometimes one thought is covering up other thoughts. So saying no one can help me is sometimes covering up I cannot ask for help. It might be covering up the thought if I ask for help, that means that I'm weak, or that means that I'm a failure. These are the types of thoughts that we need to challenge so that we can act in a way to positively impact situations. I can ask for help. Asking for help is a sign of my strength, of my resourcefulness. If I have dependents in the home, it's a sign that I am working on taking care of others by asking for help. So we can't promise that we'll always feel better when we try and change these thoughts. Sometimes we change the thoughts just to enable us to act in a way that might positively impact the situation. But if we try and challenge and reframe those thoughts each time they pop up, we might feel less anxiety, less helplessness. We might create a sense of equanimity in ourselves. We might generate hope within ourselves. Now, again, I want to emphasize that we've spent minutes on this. It's not that simple in practice. It's hard. It takes effort. These thoughts pop up repeatedly. Think of ourselves as being hardwired to worry, and many of us hardwired to ruminate. Our ancestors passed on these genes to us. Our ancestors who worried were the ones who found nutrition and could save it for times of hardship, who found shelter, who took care of their young. So we have these negative feelings because it tells us that we should pay attention to something within ourselves or our environment that's causing stress that isn't right. So it's a cue to action. When these thoughts pop up, try and pair them with these more helpful thoughts, and that can lead to feeling better over time. Okay, as we near the end of this presentation, I wanted to highlight how important our social networks are for reducing stress and enhancing coping. We can maintain and create support networks during a time of social distancing. Within our existing frameworks, schedule those phone calls, schedule those video chats if people are comfortable with that. Consider online faith, community services, exercise classes, social activity groups. I have a friend in Los Angeles, California. She takes a belly dancing class taught by an instructor in Pittsburgh, Pennsylvania. And every so often, we go outside, we're going on solitary walks, but we're talking by phone. Seek support from our networks. Now, again, this comes more easily to some people than others. So if you're a stoic Minnesotan, try and challenge yourself to share your stories. This can elicit support, help in solving problems, help in feeling better about things that we can't change. And by sharing your story, you might give someone else within your network permission to share their story with you, so it can help others to share. It can actually be an act of generosity to tell others how you're feeling and what you're struggling with. And seek support from professionals. Many providers offer telehealth. So this is another slide that I hope you'll remember from this presentation. And again, we'll share these slides with you. As I put together my slides, I searched for other university websites that mentioned coping and COVID-19. So this list of resources begins with emergency resources. If you're feeling at a loss, call the National Suicide Prevention Lifeline. In the Twin Cities, you can dial crisis or text MN to 741-741. If you work within the University of Minnesota currently, our benefits include mental health resources, so that link is here. The Earl E. Bakken Center for Spirituality and Healing has organized help by different categories, including help for health professionals, leaders in organizations, students, and community members. Again, the University of Minnesota Extension was a big help to me in putting together my slides. They have help organized by families at home, finances, food support, stress relief, leadership in business, and farmers. The Center for Infectious Disease Research and Policy, CIDRAP, has a COVID-19 personal readiness and response page. And the University of Minnesota Alumni Association organizes help by research, health and wellness, career and family, and community. So this is just a partial list of what I could fit on this slide. So Googling can also reveal helpful resources as well. So I thank you for your time. If you have any comments or questions, please feel free to share them or ask.
Yeah, thank you so much, Dr. Brady. To the audience, if you are able to stay for the Q&A and you have any questions that you'd like Dr. Brady to respond to, please put those into the Q&A box. That will help us due to the numbers on this webinar. We did have one question, and this is really interesting. I've heard a lot of folks in my network express concern about the behavior of their relatives or their loved ones and feeling particular stress about their well-being and not being unable to control what others are choosing to do in this situation. Do you have thoughts about how somebody might approach that?
So I think definitely sharing how you're feeling and what your concerns are with that family member is important. You might be able to pass on some of the resources that we've been talking about together, but definitely not being silent about that. When I see you struggling, when I see you feeling this way, and you can name whatever struggles and feelings you're observing, it makes me think this, it makes me feel this way. I'm hoping that you'll consider reaching out to this resource. It would make me feel better to know that you're reaching out to this resource. Sometimes people don't want to reach out because um, they think that it's not something that fits with their own view of themselves. But if you share the impact that it's having on you and how it will help you if they seek this resource out or even try it, that's one approach to take.
Excellent. Jim Hart, you have a question online that I was wondering about myself. How should our leaders be talking to the public? And I'll add my own note to that. I've been curious about how public health professionals or clinicians might encourage healthy coping behaviors during this kind of fragmented and stressful time for people.
Sure. I think our governor, Governor Walz, is doing a great job. Another governor who I've been watching is Andrew Cuomo from New York State. If you're like me and you have CNN or MSNBC on in the background, and we have to turn it off periodically, but if you have it on in the background, you might catch Andrew Cuomo. And one thing that I've noticed is a formula. He might not even think of it as a formula, but it is one where he will start out and he provides the facts. And he provides a strong rationale for why he is asking people to social distance or whatever the request is. If people are overwhelming the parks, why he's asking people not to do that. And he really appeals to people's better natures in terms of taking care of others, and especially our essential workers who really don't have a choice. But then what I notice is after he gives the facts, after he gives the strong rationale for why we're social distancing, he really offers these messages of hope and talks about ways that he and his own family are coping. So he'll talk about his daughters being at home and how he'll never have this time again to spend so much time with members of his family. And that is a silver lining on this cloud. He'll talk about how he didn't know what to expect when he went into this as a leader, and how sure some people might have not stepped up to the plate or disappointed him, but then there are all these people that did step up to the plate and were so helpful. And I leave listening to his daily updates feeling uplifted and a sense of hope. And so I think this is a good formula for leaders to follow. Give the facts, give the strong rationale for why we're asking people to do what we are, and then try and give some type of uplifting message or way that that leader is personally coping and that others might find helpful. And across time, you're giving different tips and strategies every day.
Okay, we have a really interesting question here. Sarah says, hi, Dr. Brady.
Hi, Sarah.
Hi, Sarah. Can you please talk about how we can use these strategies to impact systems change and policy level efforts to reduce stress and threats for larger communities of people in addition to individual strategies?
Yes, Sarah is a former student. I hope some other students are out there listening too. Our students, our alumni are amazing. You are advocates. So you can take these messages and you can talk to leaders within different organizations, your own organizations, others. We can talk to our elected leaders and talk about changes that we need to see. If you remember that social ecological model that I showed earlier, I talked about how we're embedded within different layers of social ecology. People in positions of power, they can reduce the stressors. They can change the nature of the stressors that we experience, like Governor Walz saying evictions are not happening during this time. What are resources that we can provide to people? What can we do as leaders? And we as public health professionals can advocate for those changes. And we can offer our expertise and suggestions for different policies that may be effective or different practices that people can engage in.
Fantastic. Okay, I think we'll end on this one. We have one final question asking if you know of any good resources or sites that can help individuals, I assume, with reframing challenging thoughts.
That's such a good question. So I haven't been looking for this on sites, in part because I'm aware of this model and I find these basic building blocks to be helpful. But if you're interested in going to the source, Judith Beck, she is the daughter of Aaron Beck, who really pioneered cognitive behavior therapy. It was called cognitive therapy at the time, but it involves these behavioral strategies as well. So if you want to look for that book on Amazon, I'm not thinking of the full title myself, but Judith S. Beck, I'm sorry, is the author, and it's in its second edition now. So that's something that you might want to look into. There are certainly all types of other self-help resources that have utilized this model. And I should highlight, this is just one approach to coping with stressors. Diane Newmark-Steiner, the chair of the Division of Epidemiology and Community Health, gave a great talk on yoga. If you caught that presentation, yoga encourages us to engage in mindfulness, which is noticing what's going on around us, but not being judgmental about it, not necessarily assuming the worst. And it also encourages relaxation. And so that gets our parasympathetic system going instead of our sympathetic system. So it reduces the stress hormones in our body. And Nancy Sherwood will be giving an upcoming talk on physical activity. There are behaviors like physical activity and sleep that can directly impact our feelings. So I think this is a great model, cognitive behavior therapy, and Judith Beck has a book on it. But there are many, many different ways that we can rest and relax.
Fantastic. And thanks for connecting the dots about those other webinars that we've offered or will be offering. Dr. Brady, we are so grateful, I'm sure I speak for everybody online, for the time you took to pull this together and for sharing your resources and expertise with us. For those of you who are online, thank you for taking time to join us. Please look for the recording. We will email it to you, and it will be on our School of Public Health website, sph.umn.edu. Thanks, everybody, and have a wonderful day.
Take care, everybody.
Bye-bye.